evening. I'm Mike Harristhal. I work at Hennepin County Medical Center. What an incredible turnout this is for a nice summer night. This is just I thought what I would do is be to kind of compliment some of the things that other folks have said tonight, because a lot of terrific thought and a lot of terrific perspective that you have here from the other panelists about some of the things happening legislatively and public policy-wise. I'll just speak to a couple of things about Hennepin County Medical Center. In many respects, Hennepin County Medical Center is the de facto national health plan, if you will. You know us because you see us on the 10 o'clock news, and you maybe think of us as the poor people's hospital, but we do a lot more than that. We were there when the bridge fell. I might also add, Congressman Ellison came to the hospital without cameras and visited our patients that were caught in the bridge collapse. Very humane kind of visit for him to make, which was delightful and appreciated by the patients, for sure. In addition to that, it's not only the disaster preparedness. I'll bet more than half of you were doctors trained at Hennepin County Medical Center. So we very clearly have that role in training the next generation of healthcare professionals, not only doctors, nurse practitioners, PAs, technologists, and so on. Another very, very important part of what we do. We are a general acute care hospital. You think of us for the inpatient stuff we do, and unfortunately there will always be 10 leading causes of death. And so those are the reasons we're going to continue to need to have hospital systems. Our clinic system, though, includes over 350,000 visits a year. We have more than 100 primary care physicians. Our training programs include more than 125 physicians in training. And so as Val talks about innovation, that is the way of the future, and it's very, very important. And quite honestly, I need to say for Nancy and Gita's benefit, they have been working with Hennepin on some of these very innovative ways going back probably 5 years on the coordinated care project. UCare has been there with us on that, healthcare homes, and so on. And I'll say one more good thing, actually, about the Minnesota legislature. The line item veto notwithstanding, that wasn't the legislature, was it? All right, we'll move on. But the Minnesota legislature has been very interested in healthcare reform and has worked on a number of things. And so you'll hear about baskets of care, peer grouping, healthcare homes, paying for quality, and so on. That is what we need to do. It is the way of the future. The last thing, or the last couple of points I will make is that very clearly the healthcare systems need to be working with certainly payer, private, etc., all of the folks that have skin in the game. It is very, very important, though, that we not forsake the safety net system. We are absolutely in favor of universal coverage, not only, as John said, because it's actually good business by the time you get down to the fact those folks ultimately, if they're covered, they're healthier, and they pay taxes, those are all good things. The Massachusetts experience with Commonwealth Care is that the safety net hospitals got busier as that was rolled out and they began to achieve more universal coverage. So we're not threatened at all. We think this is a great step forward and we look forward to it. The one caution we would have, at least to the Senate, because I think the House is very sensitive to this, we can't pull the funding on disproportionate share payments or medical education add-ons. Those are things that enable us to provide the care. And one concern that we would have, if there ends up being so little money left in the system, we will see the private medical community opting out, and we will then have a substantial decrease in the amount of resource available to see patients. It isn't only coverage, it is about the care to be provided. And so we need to make sure those are sensitivities as we go about thinking about how the new system will be working in the future as we do approach universal coverage. So maybe with that, I think my time is up, and very much appreciate the chance to talk with you and be part of this. Again, just an incredible turnout, and thank you all for being here.